we took much of your time. I really appreciate your attendance, and hopefully it was useful session. It is going to be present on the live for 24 hours. I'll try to save it, and hopefully we are going to have this. And if you have any other questions, please send it to me on the post, and I'll be very happy to answer. And I do apologize if I was not able to answer some of your questions. However, I'm always there. If you have any question, please let me know. Ramadan Kareem. I wish you safe and relaxing time during this pandemic, and hopefully you are going to be over. It's going to be over soon, and we'll be meeting in person. So, Dr. Omneya, eye bag with the energy-based devices. Do you want me to continue, or shall we end the session because you are coming back? So I don't know. Let me know if you want me to continue. I don't have any issue. Hi, Rebecca. How are you? Dr. Lana is going to be recorded, inshallah. So let me know. Okay. Some people are... Okay. To continue, ask me to continue. Okay, eye bags with the energy-based devices. It depends on the stage. If it is advanced stage, then oculoplastic surgery is the only solution. However, if it is mild, then we can do some energy-based devices like microneedling radiofrequency or laser. I use the erbium YAG laser with long pulse in order to tighten the skin, and this might improve the situation. So this is regarding the eye bag. Okay, any more questions we did not cover? Dr. Omneya, you had a question I think I did not answer, so please post it again if you want me to answer that. Hi Harry, how are you? You are more than welcome. Thank you. One of the other things which I just wanted to Dr. Riham, the combination treatment for face lifting with energy-based devices. Whenever we have skin laxity, Dr. Riham, we have to realize that it is not only in the subcutaneous layer. The problem is not only the subcutaneous layer. We have lost fat in the subcutaneous layer. We have lost collagen at the level of the dermis. And we have also damaged epidermal barrier function, where there is transepidermal water loss. And with epidermal water loss, we have dry skin and impairment of the skin elasticity. So in order to improve the skin laxity and to tighten the skin, we have to target all the layers. We have to work on the epidermis, we have to stimulate collagen, we have to tighten the skin. There are so many ways to achieve each of those layers of the skin and improve it. I don't want to dictate anything, but you have to remember that each layer needs to be addressed. So use your tools in order to address the different layers in the skin. I personally do technologies like the Oxygeneo or the MISJET or the whatever for the epidermis. I use the Nd:YAG laser for tightening and stimulating the collagen in non-ablative method. Those are the ways I do. If there is acne scars, I combine with that microneedling radiofrequency as well. So this is what I do. Dr. Omar, about Nd:YAG for erythema, we use it with the parameters for rejuvenation because this is going to stimulate the collagen and compress the vessels, so this is going to improve the erythema. Okay. Why some patients get thicker hair after treating fine hair with the Q-switched Nd:YAG laser for bleaching or the bleaching? When we are using the lasers, it can cause some heat, and heat will cause photobiostimulation. So we can turn fine hair into a thicker hair, and this is called paradoxical hair growth. So if this is the case, then you need to use long pulse duration and higher fluence to get rid of the hair and induce reduction. The parameters of the NDAG for rejuvenation, we are using 7 millimeter spot size. We are using 0.3 to 0.6 millisecond. Anything in that range would do a good job. We are using 15 joule per centimeter square, and then 5 hertz, and then we do painting. So we do the passes in a painting fashion, and we need to control the temperature of the skin. We need to get 42 degrees and maintain that for 3 minutes. So this is how we can get good results. We need 3 sessions, 1 month apart. Okay, you're welcome, Dr. Riham. Is it safe to reopen the clinic and deal with the patients during the quarantine? Of course, no. Of course, no. Not actually, I mean, the coronavirus is a virus. However, till now, we don't understand how to deal with it. And even if it is only 10% who are going to be severe and having problems, this is a significant amount of time, and transmitting the disease to our family members is a big risk, and we cannot afford losing family members. So I don't recommend that. And till we know how to deal with the disease and in the best way. So I don't recommend, Dr. Lamia, to open clinics and offer aesthetic services now. This is my opinion. What are the parameters, Dr. Omneya? I just mentioned it. It's going to be in the recording, inshallah. Laser treatment for hair loss and parameters. Hair loss is a big issue. We have to understand the pathogenesis and the reasons behind it. If there is any systemic cause, it has to be treated. If it is androgenic alopecia, then we have to use the minoxidil. The LED, light emitting diode, is something which can be used as an adjuvant therapy. It is not the monotherapy. It can be used, but to be effective, it has to be home use, because the session should be on daily basis for 5 days, every week, every day, 10 minutes. So the home use devices are the best, and this is something which should be sold by the clinics or the companies to the patients. You are more than welcome, Dr. Omneya. Kauthar, can we use the laser CO2 for tightening the skin? No, CO2 laser cannot tighten the skin, especially the fractional. It can stimulate the collagen, it cannot tighten the skin. Sometimes in the old days we can use it for tightening around the eye, but then we have risk of scarring and also hyperpigmentation in dark skin. Can we use alexandrite for Mediterranean? Yeah, we can use the alexandrite for hair removal for skin type up to 4, but after that the NDAG would be much safer. Dr. Zainab. Dr. Nermeen, cooling with parameters? No, we don't use cooling with the parameters of rejuvenation, because the rejuvenation will work only by getting the skin temperature to 42 degrees and maintain that for 3 minutes. If we use cooling, this is going to decrease the efficacy, and it's not going to be very effective. The clinics are open in Dubai. They are opening now. I don't know if it's a good idea or no, but if that happens, then all the precautions should be taken very, very seriously. I wish you to be safe with that. Hermine, according to depth of hair, can we decide to choose laser hair removal? According to the thickness. If the hair is thick, NDAG is the first choice, because it goes deep, because it is safe, and because it goes deep, the NDAG. If the hair is finer, then you can use the alexandrite if the skin is fair, but you have to keep working with the NDAG if the skin is dark, because the alexandrite won't be that safe. But in this case, with the NDAG, you have to use shorter pulse duration, smaller spot size, and increase the fluence. Hair removal in case with active vitiligo. Very good question. Can we use the laser hair removal with active vitiligo? It depends if the patient is having Koebner phenomena. If the patient is developing new lesions on trauma, then laser is contraindicated. But if this is not the case, then we don't have any problem. In treatment of lip hyperpigmentation, using the Q-switched lasers in lip hyperpigmentation. I don't use the KTP at all because it causes more hyperpigmentation. We can use the Nd:YAG with low fluence just to mechanically shutter the pigments, although I prefer to use topicals because there are some reports of darkening of the pigments with the Q-switched lasers, but this happened mainly with the KTP. So the Nd:YAG might be a bit safer. Thank you, Harry. Dr. Riham, can we do RF session after filler? Actually, you have to wait for at least 3 weeks so that the filler is becoming more stable. If you use the radio frequency, it's going to cause heating of the tissue, vasodilatation, and the filler is going to be shorter term. So it's going to go away be absorbed much faster. So I don't prefer to use before 3 weeks the radio frequency. With the Botox, we need to wait 2 weeks after the injection of Botox. So 2 weeks after the Botox, 3 weeks after the filler. Those who are worried to work now, I mean that's much safer, and I totally agree with that. Dr. Nermin, you are more than welcome. When do we use CO2 for skin type 4? If this is the only laser you have, then you have to work with it. I totally understand, but prepare the skin well for 2 weeks before the session with hydroquinone 2% and sunscreen. And after the complete healing of the skin, also use sunscreen very regularly, every 3 hours, every day. Thank you, Dr. Lamia. Laser Nd:YAG for tightening without cooling. Yes, I use it without cooling. Because with very long pulse duration, it is safe, it is good. You always in painting mode, and everyone is happy. So yes, we can use the Nd:YAG without cooling for tightening. So I think by this we answered most of the questions. Once again, I would like to thank you for joining me. And if you have any other questions, please don't hesitate to post it, and I'll be very happy to answer the questions. Take care and stay safe. Thank you. Bye-bye. Angiokeratoma, which laser? We can use the Nd:YAG, we can use the pulsed dye laser, and also, yes, we can use the electrocautery, but Nd:YAG and pulsed dye laser would be very good. Nada, thank you very much. Marjan, thank you, and wish you all the best. Thank you. Assalamu alaikum.